Welcome to this channel. Pancreatic cancer isn't just a smoker's disease. It can happen to anyone. Let's break it down in plain English. Intro: I'm Dr. James from Pancreatic Cancer Warriors. Today, no confusing jargon, just clear facts to save lives. By the end, you'll understand why this cancer is so deadly and how to fight back. What if I told you there is a hidden organ that when it malfunctions can lead to a deadly cancer that is often undetected until it is too late? Well, there is, and by the end of this video, you'll know what to do about it. First, we need to start with the basics. What even is the pancreas? Imagine your digestive system as an assembly line. After you eat, food travels along this line, getting smaller and smaller until it reaches your small intestine, where most of the digestion and nutrient absorption happens. Your pancreas is one of several organs that sends workers to this assembly line. Specifically, the pancreas sends enzymes, which are like tiny machines that help break down fats, proteins, and carbohydrates. Without these workers, your food wouldn't get digested properly, and your body wouldn't get the nutrients it needs. But that's not all the pancreas does. It also makes hormones like insulin, which are chemical messengers that travel through your bloodstream and tell your body what to do. For example, insulin tells your body to take sugar from your blood and put it to use or store it for later. Without these hormones, your body couldn't properly process sugar, leading to high blood sugar levels. Next, let's talk about what goes wrong in pancreatic cancer. When healthy cells in the pancreas begin to mutate or change, these cells grow out of control and form a tumor. This abnormal growth can block the pancreas from sending its workers and hormones to the assembly line. Think of it like a traffic jam in your digestive system. The backup of undigested food can cause all sorts of problems. For example, when the traffic backs up, the person in front of it, your stomach, starts to swell. This can make eating and drinking difficult. The hormones that usually come from the pancreas can't get to where they need to go. This can lead to problems with blood sugar control. And if the cancer spreads, it can cause jaundice, which is a yellowing of the skin and the whites of the eyes due to a buildup of a yellow substance that's made when red blood cells are broken down. Why is this cancer so dangerous? There are two main reasons. First, there are no early symptoms. That means you may not know you're at risk until the cancer has already spread. Second, it spreads fast. It's like weeds taking over your garden. If left untreated, these weeds will choke out your flowers. In other words, the cancer can quickly spread to other parts of the body, making treatment much more difficult. Who is at risk? Anyone. But some factors can increase your risk. For example, smoking increases your risk because tobacco smoke contains which can damage DNA and lead to cancer. Also, people with diabetes have higher levels of insulin in their bodies, which may promote the growth of cancer cells. Finally, people with a family history of pancreatic cancer are at increased risk, but sometimes there is no reason to blame. We hate to sound like a broken record, but early detection is key. Unfortunately, there are no routine screenings for pancreatic cancer. You don't want to be screened unless you have symptoms or risk factors. However, new tests are being developed that can catch pancreatic cancer early when it's most treatable. In our next video, I'll share these new tests with you. Make sure you subscribe so you don't miss it. We've talked about what the pancreas does, how cancer affects it, and why it's so sneaky and deadly. Now we need to discuss the different types of pancreatic cancer so you know what to look out for. There are two main types of pancreatic cancer: ductal adenocarcinoma and neuroendocrine tumors. Ductal adenocarcinoma is the most common type, accounting for about 80% of all pancreatic cancers. These cancers start in the cells that line the ducts or tubes that carry digestive enzymes from the pancreas to the small intestine. Neuroendocrine tumors, on the other hand, start in the hormone-producing cells of the pancreas. These tumors are much less common, accounting for only about 5 to 10% of all pancreatic cancers. They do have a slower growth rate, and they are more likely to be found early than ductal. Still, regardless of the type, once pancreatic cancer has spread, it becomes much more challenging to treat. Now let's talk about how pancreatic cancer spreads. Like most cancers, pancreatic cancer spreads through a process called metastasis. This is when cancer cells break away from the original tumor and travel to distant parts of the body. Pancreatic cancer tends to spread to the liver and the lymph nodes first. As the cancer grows and spreads, it can cause a range of symptoms from abdominal pain and weight loss to jaundice and changes in stool. The earlier these symptoms appear, the more advanced the cancer is likely to be. If you're worried about your risk of pancreatic cancer, see your doctor. They can ask you questions about your lifestyle and family history and perform a physical exam to check for any signs or symptoms. Remember, knowledge is power. The more you know about pancreatic cancer, the better you can protect yourself and your loved ones. Subscribe so you'll never miss an update. So now that you know the basics of pancreatic cancer, let's talk about how to prevent it. While there's no guarantee you won't develop pancreatic cancer, there are things you can do to reduce your risk. First, avoid tobacco in all forms. If you smoke, quit. Second, maintain a healthy weight. Obesity is associated with an increased risk of pancreatic cancer. Third, eat a balanced diet with plenty of fruits and vegetables. Fourth, exercise regularly. Aim for at least 150 minutes of moderate intensity exercise per week. Finally, limit alcohol consumption. We've discussed the importance of early detection, but what are the early warning signs of pancreatic cancer? Unfortunately, in the early stages, pancreatic cancer often doesn't cause noticeable symptoms. It's like trying to spot a tornado by looking at the sky. Just when you think it's clear, one can appear out of nowhere. However, as the cancer progresses, it may start to show some warning signs. These include abdominal pain, especially in the upper abdomen, persistent pain in the back or in the left shoulder blade area, unexplained weight loss, loss of appetite, nausea, especially after eating, changes in stool, including oily or greasy stools or clay-colored stools, jaundice, which is a yellowing of the skin or the whites of the eyes, and new-onset diabetes or difficulty controlling blood sugar levels. If you notice any of these warning signs, see your doctor right away. Don't try to ignore them, hoping they'll go away on their own. Early detection and treatment can make a big difference. There are several ways to diagnose pancreatic cancer. The first step is usually an upper endoscopy. During this procedure, a thin, flexible tube with a camera attached is inserted down your throat and into your stomach. The camera allows your doctor to view the inside of your stomach and the first part of your small intestine. If anything suspicious is found, a biopsy can be done where a small sample of tissue is removed for examination under a microscope. Other tests such as CT scans, MRI scans and PET scans can also be used to detect and stage pancreatic cancer. Staging refers to the extent or spread of the cancer. If pancreatic cancer is suspected, your doctor may order additional tests to determine the stage of the disease. Once pancreatic cancer has been diagnosed, treatment options will vary depending on the stage of the cancer and the patient's overall health. Treatment may include surgery, chemotherapy, radiation therapy, or a combination of all three. Surgery is an option for some people with pancreatic cancer, particularly those with localized tumors that haven't spread to other parts of the body. During surgery, the tumor and a margin of healthy tissue is removed. Chemotherapy uses drugs to kill cancer cells. It can be administered in various ways, including intravenously, orally, or through a port implanted in a vein. Radiation therapy uses high-energy rays to destroy cancer cells. It can be delivered externally using a machine or internally through radioactive material placed near or inside the tumor. It is important to remember that everyone's situation is unique, and treatment plans should be individualized based on the specific circumstances of the patient. For example, if the cancer has spread to other parts of the body, surgery may not be an option. In that case, treatment may focus on managing the symptoms and improving quality of life. It's essential to work closely with your healthcare team to decide on the best course of action. They can help you weigh the risks and benefits of each option and make informed decisions. Don't forget, knowledge is power. If you've learned something new or found this video helpful, give us a thumbs up. Subscribe to stay updated on pancreatic cancer. Check out our other videos for more valuable information. And remember, share this video with your friends and family. It could save a life. Stay strong and keep fighting. Together, we can beat pancreatic cancer.